37, from a record surge in measles cases to the ongoing cyclospora parasite outbreak, public health officials are tracking multiple disease threats at once. At the same time, some researchers argue recent changes to federal health agencies could make it harder to detect and respond to future outbreaks. Joining us now is Hayley Brown with the Center for Economic and Policy Research to help us put these public health concerns, really into some perspective here. Hayley, good morning.
Morning. Thank you so much for having me.
Yeah, so we're hearing about the cyclospora outbreak, measles, screwworm, and other health threats. For perspective, are these isolated events in your opinion, or do they kind of point to a broader trend?
Yeah. So of course, with any individual outbreak, it's always difficult to know for sure what the counterfactual would have been. We don't know that if some of these regulatory and staffing cuts hadn't happened, if this would have still occurred, and we don't know how much those staffing changes have affected it. However, there is overwhelming circumstantial evidence that we have created an environment where it is harder to prevent, track, and contain these types of outbreaks when they do happen.
I thought it was interesting because your research points out that changes at the federal level have actually weakened our public health response. What are you most concerned about?
A lot of concerns. One of the big ones is staffing cuts. So, a lot of the agencies that are responsible for tracking and containing these types of threats have experienced significant staffing cuts. And when you lose experienced, knowledgeable staff, you're losing capacity to do really important things, particularly when you have outbreaks and emergencies, and especially when you have multiple outbreaks happening at the same time.
Well, to build on what you're saying, the CDC and other federal agencies, we know have experienced staffing cuts. How does that affect the ability to detect and then respond to the outbreak?
Yeah. So every knowledgeable person who would have been part of that control room, making sure that we are doing absolutely everything that we can to respond to these types of outbreaks, who is no longer there, that's a significant diminishment in capacity. And for cyclospora, in some cases, there are entire advisory committees that were eliminated as part of staffing cuts. One example is the United States Department of Agriculture's National Advisory Committee on Microbiological Criteria for Foods, which was working on best practice guidelines to combat foodborne illnesses shortly before its dissolution. In April 2025, federal workforce cuts actually forced the suspension of the Food Emergency Response Network proficiency testing program, which was designed to make sure that network's food testing laboratories around the country could produce quality results during an emergency. These are exactly the types of programs that we need, both to try to prevent things like this from happening and also to respond to them if and when they do happen.
As we have to let you go here shortly, I wanted to ask you this because one of the biggest challenges with the cyclospora outbreak has been identifying a source. And when you think about how hard it was to trace the particular parasite, what comes to mind about what's going on the federal level that really has contributed to this situation?
Yeah, so cyclospora is difficult to track. It has a very long incubation period. That said, there are things that we could be doing better. So the federal government has something called the FoodNet Active Surveillance Program. It was not initially intended to combat active outbreaks, but it's something that could theoretically be built upon to have more capacity. Because it's an active surveillance program, it's distinct from other types of surveillance run by the CDC. And active surveillance means that they are contacting laboratories proactively to get results, and it means that they miss fewer resulting and therefore piece together more of the story. It also is really important historical data so that we can gauge whether or not we're actually seeing an increase in outbreaks at a given time.
All right.
Previously, this program was required to track cyclospora. And during the second Trump administration, cyclospora, among a host of other diseases, became optional because they wanted to conserve capacity for other things,
All right.
in part because there were all of these ongoing cuts.
Got to run, Haley. I'm so sorry. We are out of
Okay.
time. I
No,
certainly
it's okay.
appreciate you. Again, Hayley Brown with the Center for Economic and Policy Research. Thank you for the conversation and your perspective. We appreciate it. All right. Jackie,
Thank
out
you.
to you.